Without further ado,
Yeah.
Dr. Anastik.
Thanks a lot. Good morning, everyone. How on earth I'm going to deliver my speech after that presentation? I'm a scientist and I live in the UK, but originally I came from Poland, so I'm also Polish. And first of all, I would like to thank Alberta for this kind opportunity to give a talk and presentation. The only one thing that I can say, God, I'm jealous how far you are ahead compared to where we are. And I'm going to show you some of the work that we're doing at the moment in the UK and also Europe. So the title that I was asked to give was to look at the European perspective within 20 minutes. Well, European Union's got 27 countries. And one thing that maybe some of you are not aware, UK is not part of European Union anymore. We had Brexit in 2020. So UK is not part of the European, which kind of I'm also presenting today. Not to make even worse is that UK's got 4 devolved governments, which is Scottish, Welsh, Northern Ireland and English. So each of that works independently, particularly if you look at the firefighters' approaches to their health and so on. So, I think that's for the next slide. Well, I'll try that one. Oh, I'm going back. Oh, that's forward. Yeah. Right. So one thing that gets me is that while the firefighters' mission remained the same across the globe, working environments and conditions are really different between the countries. And the one thing that I came to is, within 20 minutes, what is the major thing that actually is similar within those countries? So, coming a bit to the science, with the most of the data that I'm going to present was commissioned by the Fire Brigades Union in the UK. And what you can see is actually some of the results are from the survey that we ran amongst firefighters in the UK. So we set up the questionnaire for 3 months, and we had around 11,000 firefighters responding to quite a number of questions. We were not popular because there was around 70 questions, and I know that firefighters like no more than 20. But what you can see is kind of diversity and the factors that might affect an increased likelihood of developing cancer amongst firefighters. At the bottom, you've got something what we call odds ratio. That's the likelihood of developing cancer. And on the left side, you can see different factors that are giving statistical significance, which are related to the higher occurrence of the cancer. So, if firefighter has longer term service in fire rescue service, the cancer likelihood increases. And that's particularly seen where the firefighter have 15 years plus. Similarly, something what was mentioned today, contamination, decontamination. Well, I know you're a lot ahead of us, but we just only learned on contaminants in the UK pretty good 6-7 years ago when we started that work. And the things that we learned is from the firefighters that the cancer likelihood increases when we don't have any regulations or procedures on contaminants. So, for example, if firefighters are coming back from the fire incident and they do not decontaminate their PPE, they're not separating dirty and clean PPE, they've got smell at the workplace, that's all contributing to the cancers that we can see amongst firefighters. And then we've got personal decontamination, which is also kind of responsibility that firefighter needs to pick it up, such as showering and removing contaminants, particularly from the open fires such as wildland. So the things that brought me to the discussion are really 4 things that kind of are similar within the Europe and UK. First of all, workforce and staffing. Obviously, it's directly relevant to the finances, but I'm not going to talk that today. I'm going to talk about the declining number of firefighters that are kind of going for and applying for the fire rescue service in Europe and in the UK. Work conditions, that's firefighters at work and contamination at the workplace, but also working conditions. And when I'm talking about working conditions, I'm talking about that's not me, about firefighters who are going to attend the fire incident, for example, not wearing any respiratory protection. Regulations, policies, what we've got in Europe and also in the UK, And one of the things I know that we heavily focusing on the health monitoring and screening, but we cannot forget anything about the culture, and that was really nicely mentioned at the earlier speech, badge of honor, which I'm going also to show you some nice data, training, awareness, and so on. Right, we know that firefighters have higher rates of cancers. Interestingly enough, World Health Organization found direct link between firefighter cancers occupation, something what you knew for many years. Yet in Europe, for example, till very recently, firefighter risk occupation was not even listed as a higher risk. So firefighter occupation in Europe was classified as anyone who sits behind the desk. And if you go for the hairdresser occupation in the European Union, that was higher risk occupation simply because they're dyeing hair, which having a lot of carcinogenic substances. So within the European Parliament, where UK was still part of it, we started kind of having that open debate and discussion to recognize firefighter occupation as a higher risk. And I can gladly tell you that we did that change just a month ago, but I'll tell that a bit later. One of the increases likelihood of cancer comes from the exposure to contaminants. And you can actually specify me talking about contaminants. I had to change my vocabulary because when I started working in the firefighter sector, I was talking about fire toxicants, and I'm kind of doing fire toxicity. And then everyone's saying, well, don't mention fire toxicants because that scares firefighters. And actually, we shouldn't discuss fire toxicants. We should discuss contaminants. Well, I will partially agree that contaminants are not necessarily only toxicants that will have a harmful effect to a human. But within the last 4 years working in the UK, I'm talking now about fire contaminants. Well, really, if we're talking about cancers, we're talking about fire toxicants. And if we look at the exposure of firefighters, sadly, it's not going to change really massively because we can see a huge replacement of natural products with the plastics. And a very good examples, I can see a few sessions later on today, is electric bikes, which we can see a very big spike in fires, at least in Europe, lithium-ion batteries, solar panels, and so on, and also chemicals. Huge session on PFAS, perfluorinated chemicals, but do not forget that we've got also other chemicals that are added to the products, gas phase halogenated flame retardants, which are also kind of, some of them are banned, some of them kind of proved to be pretty having a harmful effect on a human, and we can see definitely that also across firefighter sector. So we've got that increase of the plastic materials. We definitely can see increase of the severity of the fire spread. But we also can see much higher concentrations of those toxicants that are released. And the problem we scientists have is that we only testing chemicals that we learned that they are bad. So perfluorinated chemicals, they were introduced to the market many years ago, but we only learned about them because there is evidence and growing up evidence. And similarly, when we're trying to correlate firefighters' cancer to exposure to specific chemicals, we targeted only some of the groups of them. We know that there are thousands of chemicals released in a fire, but we only choosing the ones that we are aware of. So kind of complicated, yes, difficult, yes, but they are contaminants that are generated in every single fire. And when I'm talking about it, soot is a really good indicator. Soot is built up by PAHs, and someone might mention later that, polycyclic aromatic hydrocarbons, which many of them are classified as carcinogenic. There is no problem to find, at least in UK and in European fire rescue services, there is no problem to find soot in the firefighters' workplace or on their PPE or on their hands or face. So coming back to the first point, workforce and staffing. Sadly, we see a decline for the last pretty good 5 years in firefighter population. And if you look at European countries, UK is not part of it, but I added that in, you can see huge decline in firefighters. Interestingly, if you look for the majority of the wildland fires in Europe, Portugal, Spain, France, you will see much smaller or bigger numbers of the declining. And the other thing that is really kind of coming on agenda is changing the retirement age. So far, retirement age when we're talking about firefighters is more or less 60. But in Europe, some of the countries, such as Belgium, is trying to introduce 67. What the consequences might be for it? Well, from our data, we know that we can see a top peak of increasing cancer rates at 45 and really getting hit to 49 years old. That's when the cancers starting showing up in firefighters. Majority of them will go through the cancer when they are 55. So if we're increasing retirement age, kind of the question poses, how many firefighters actually will have to go and tackle fires? And particularly on a climate change, an increased number of the wildland fires will have lower number of firefighters going for and attending fires for much longer and being exposed also for much prolonged times. So, yep, quite interesting point to look at the increasing retirement age. One thing I should point it out, currently, UK and European Parliament does not have presumptive legislation for firefighters' cancers. None of the countries is offering regular health monitoring for early detection of cancers. Having said that, one country is exception, and I'm going to say proudly that it's Poland, and I'm going to talk a bit later when I'm going to the cancers. Regulations and procedures. Anyone who's working on that in UK or other countries, because I know there are different speakers also from the other countries, if you've got any regulations on contaminants and firefighters wearing respiratory protection, please tell me what it is. Because in UK, we don't have really procedures that firefighters must wear respiratory protection when they actually going for the post-fire or any open fires. We've got when they tackling the fire, such as, for example, Grenfell Tower fire, for those who heard. They're supposed to wear breathing apparatus, but anything in terms of dumping over and all of that, there is no requirement to wear that. And it depends on the brigade that is tackling it. So as you can see, within the regulations and lack of regulations, we can see still huge majority of the firefighters who eating and drinking with sooty hands, lack of the contamination procedures. 84% firefighters still do not wear any respiratory protection. And if we say in the UK, why? You've got habit, so culture, we are far behind that of changing the culture and awareness. But we also got nobody else wears it because I'm told I don't have to, I decided not to. So you've got this. And in Europe, really advanced countries for the protection of firefighters. We're looking at the Scandinavian countries, Norway, Sweden, and Finland. They are really, really proactive. And what you had is that in 1994, Norwegian actually introduced the guidance on wearing respiratory protection, particularly when you're looking on the knockdown or overhaul fires. And if you look at how it's influenced the wearing respiratory protection, you can see that pretty good before the introduction of the guidance. Majority of the firefighters, 80-90%, did decide not to wear respiratory protection. But after introduction, it's starting changing to 2010. You've got 80-90% of firefighters wearing respiratory protection. So introducing guidances absolutely make a change. And I know that you probably know that, but yeah, we don't have that yet. Culture and awareness. Oh, that's kind of small text. Apology for that. Badge of honor. Yes, we have that. And we're probably 20, 30 years behind you on that. Really interesting point. You can see that 64% of firefighters believe of badge of honor. But what is more interestingly is that 46% of firefighters who were questioned said, yes, there is badge of honor, but it's not me. It's someone else in my brigade, which kind of tells you the approach of firefighters to actually admit and tackle the problem. And for those who said, I believe that there is badge of honor, they were associated not only with the higher rates of cancers, but those were firefighters who also did not decontaminate, did not wear any respiratory protection when they were attending the fire incidents. They also had no regulations or procedures on keeping the workplace safe and healthy from the contaminants. So Fire Brigades Union follow up and based on the lack of guidances on contaminants. We had a pretty good guidance on asbestos, but we didn't have anything in relation to contaminants. They actually said, can you do a literature review worldwide on contaminants? Can you do that questionnaire, which I just kind of showed some of the data? And can you provide some recommendations what we should do? One requirement, it cannot cost, because fire rescue service is struggling financially. So we had to find somehow consensus without kind of reasonable assumptions, which would not cost. We've done it. It's publicly available. One thing that I should point it out is that that was released 2020, but we had Swedish best practice document, which was released pretty good decade earlier. So again, Scandinavian countries is something what we very closely follow up and looking as example. The good thing about the best practice, it's there. It's starting changing culture and awareness amongst firefighters. Amazingly, that was translated into 6 languages, which mostly in Europe. And even far more kind of advanced is that Polish government translated this best practice into documents and approved this as a mandatory guidance on minimizing exposure to contaminants. Recommendations, especially looking at the contaminants at the workplace, were implemented from January last year, 2023. So they didn't have to prove about contaminants in their country, because that's something what I really struggle in UK. So first of all, I was hearing UK is the best. We don't have problems with contaminants. We don't have problem with cancers. So when we starting saying, can we look at the contaminants? No, we are much, much better for that. So I spent 3-4 years going through the questionnaire, literature review, indoor air quality to show that there is an issue. And then 2 years ago, I found that, yeah, we were aware of contaminants. We knew that firefighters are exposed, but we don't know how much intake of those contaminants are, which kind of leads me to the second part of the project, health monitoring and cancer. But the Decon campaign is doing really well, and I can say that 98% of fire rescue services in the UK actually improved their facilities and improved their approach towards contaminants, so it really works. So where are we up to with the cancer? Because I know that this presentation is supposed to be on cancer. Where we are on the cancer, EU introduced the first presumptive legislation law, 1982. That's bloody a lot of time to catch up with us. Followed by Canada, Australia, and I know that there will be some speakers from Canada later on. Poland. Poland was really interesting in 2019 because they said, we don't need to reinvent the wheel. We will just follow what US did, and we will introduce presumptive legislation. They did. They did for cancers and diseases. We've got first European member state that introduced in 2019 presumptive legislation for firefighters' cancers. At the moment, the work in Poland is on looking at the health monitoring. And then 2022, World Health Organization, as well as you know, introduced and provided direct link between firefighters' cancers and and occupation. In Europe, European Parliament, well, we try to talk about increased risks and occupation of firefighters in Europe from 2017, and I'm really glad to say that in October 2023, we had a mandate that European Commissioner is going to create a guidance that every single firefighter should have a mandatory training and awareness on decontamination. Keep in mind that this kind of directive is under asbestos, and you just say, well, asbestos? Yes, but it's opening the door. Once we've got that guidance, it's opening the door for contaminants, everything else that's not asbestos. And then February 2024, yes, we did it. There was a voting in February, so just now, this month, first week, where we, under the directive of carcinogens, mutagens, the IARC, World Health Organization report, was approved, accepted and acknowledged, which means that according to European Union law, now firefighters have occupational cancers. It is recognized. What are the consequences? Well, in Europe, every single member state will decide what to do with it. European Parliament cannot put and force to do anything on it, but it says that each member of the state needs to tackle it and needs to address the issue of firefighters' exposures and cancers. So, pretty good step forward. What we do at the moment, well, in the UK, again, Fire Brigades Union initiated and funded our university to test 1,000 firefighters across UK, which we just completed. And we collected blood and urine to test for 63 clinical markers for cancers and diseases. And we also test blood and urine for fire effluents and metabolites. What we're trying to see is how firefighters are exposed to contaminants, but also to see if there is any link between those exposure to contaminants and cancers. At the end of that, we also want to develop health monitoring package for the UK firefighters. Why I'm saying UK? Because if we're trying to compare this to the US, and I will just give example of the wildland fires, we not necessarily have wildland fires in UK. We've got peat and grass fires, which toxicologically significant is really different from the fire emission perspective. Personal protection equipment, completely different. Practices, approaches, culture, behavior, really different. So we really need to target it. Types of the cancers which are also different in UK compared to the UK. However, similarities between the cancers are we can see dominance of the skin, digestive cancers, similarly as worldwide data. One thing that I'm kind of going very careful is anywhere I'm going on the conference, I'm just saying, can you compare the cancers between different countries? Well, we can definitely state there is a higher occurrence of the cancers, but we cannot compare data to data because how the data is collected, how the data is generated, the factors that will affect those cancers is really, really different. So we need to be extremely careful how we collect and analyze the data. And that brings me to the conclusions. Well, first of all, really amazing experience because I was kind of a member of the IARC and World Health Organization, and I learned one thing. In order to really lead the changes and really recognize your work as a firefighters, we need to work together. There is really no point to work on its own for its own target. And the way that we can do it is through today's meeting. Knowledge sharing, global collaborations, and also nice drinking in the evening where we can entertain a bit ourselves. And on that point, I will thank you for attention and pass it to the next speaker. Thank you.